Hello, everyone. Hello, hello. Hi. Come on in. Come on in. Welcome, welcome. So I'm going to see if people are coming in. Hello, hello. Hi, this is Q&A with Dr. Mercy. I'm Dr. Mercy. Welcome to another episode. Happy, I guess, last day of the week. I hope you guys are enjoying yourself. I know you may be just be getting out of work. I hope you are having an interesting day and relaxing and having some R&R. Welcome, welcome, welcome. I'm Dr. Mercia Joanway, and we're going to have a very engaging conversation. Hello, Todd Reed. How are you? Hi. We're going to have a very engaging conversation just to kind of um, give a discussion about the last week when we had the um, interview when it came to breast cancer. Hello, everyone. If you guys can type where you're viewing, what location you're viewing this live at, that'd be great. I always love to know how far our reach is. So if you can type where you're viewing us from, awesome. But hello, Janice Hobbs. How are you? Hello, LinkedIn user. Don't know who you are, but hello, hi. All right, all right. Like I said, it's going to be a brief conversation, but a conversation nonetheless. October is Breast Cancer Awareness Month, and so I decided that for this month we're going to primarily dedicate our discussions on breast cancer, how we can prevent it, and just awareness of it. Oh, Patricia, you're from Dallas, close by. I'm here in Houston. Okay, Crystal Clark, Michigan, great, nice. Latika from Charlotte, I was just there a couple months ago. That's awesome. Carmen from Atlanta. Oh, it's coming in. Oh, Chesapeake, Virginia. Nice, nice, Dr. Nicholson. Awesome. Yes, I'm doing well, Janice. Thank you so much. So, again, we're just going to recap on how our conversation was from last week. Did you guys enjoy last week's discussion? For all of those who didn't see it, I'll just do a quick recap, but it's probably better just to go back to the video and kind of look. Oh, Corpus Christi, Letitia. I actually used to live in McAllen, so I was very close there. Oh, nice. Welcome. Thank you. Thank you, Razan. I look forward to our discussion. So anyways, I'm just going to do a real brief recap on what we discussed. So last week, we actually had a video that I kind of posted. I posted part one, and next week we'll be doing part two. And so part one was dealing with a breast cancer patient or a person with breast cancer. Her name is Tony Fowler. And during that conversation, she was talking about how she found out of her diagnosis. It was really at a very stressful moment in her life. And then she also talked about how she did different lifestyle changes, particularly diet, and the different kinds of diet she instilled when she found her diagnosis, and how that positively affected her symptoms that she had with breast cancer. And so she at the end, even I was left just at all with her, because she tied in her spirituality, she tied in just positive thinking. At first she said, okay, yes, I've been diagnosed with breast cancer, yes, it's spread throughout my body, but this is, even though sometimes I wonder why I have this, I do know that in the end, God is in control. And I just know that this is going to be a part of my story. I mean, the positive affect that she had, the joy that she was instilling, it made me realize, and even for me as a physician, I was thinking, like, okay, this is someone who's going through a cancer, and yet she has such hope. And so it made me put things in life into perspective. And so I hope you guys actually, like I said, I hope you guys enjoyed that conversation. If you don't remember, if you weren't there, just go back to those videos, or actually it's a video, and just view it and you'll see what I'm talking about. But during that video, I decided that, or I said during that video at the end that I was going to review all the comments and just point out some of them that we can discuss in later sessions. So this is session number one of the post discussion. And there was only a few comments that was on that video, but I wanted to highlight them because I thought that they were important. So the first one came from Pamela Legrand. Pamela had said that her mother passed away from lung cancer in 1997. I know, Latika, she did have some amazing faith. I was just like, wow. But anyways, so Pamela Legrand said her mother passed away from lung cancer in 1997 and she's never smoked cigarettes. So I just wanted to bring that comment out. I know it doesn't have anything to do with breast cancer. It is lung cancer, but it did highlight a misnomer about cancer that I wanted to kind of just highlight. Yes, cancer does cigarettes cause cancer? Yes, it does. But does are all cancers caused by cigarette use? No, it isn't. Especially with lung cancer. Although lung cancer is the third most common cancer, there's so many different types of lung cancers, and not all of them are associated with cigarette smoking. A lot of times you can have cancer in general, okay, due to your genetic disposition. So genes, we love them, but sometimes, they can act up. And with cancer, if you have you may have a genetic disposition of cancer just because of your genes. So that's one. Two, environment. And that's a very, 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 very key factor. Um, what we eat, what we inhale, okay, even sometimes what we touch can cause cancer. And I remember back in medical school going through what they call a toxin tour, okay? And I was so amazed because they literally put us in a school bus, okay, and had us go throughout the town and said, okay, that neighborhood, there's a whole bunch of people with cancer there, but you can understand that because there's a plant right there. And that elementary school is right across the street from this plant. And so the fumes coming from that plant is going to be affecting these children. And I'm like, oh my gosh, is this even legal? Is this why in this day and age are we allowing this to happen? So you have to be careful, the places where especially where you live, and you have to look around and see are you around any hazardous sites or anything like that, because it's important. I mean, you guys have seen the stories, you guys have heard Flint, Michigan. You've heard that when there's environmental hazards, it affects you. Another example of another lung cancer that's not really attached to cigarette use per se is lung cancer from asbestosis. So back in the day, back in I think it stopped in maybe in the 80s or so, asbestos was used as a construction material that they would use for, just simple construction, home construction, things of that nature. And, I guess it was a good material. That's why they're using it. But studies had shown over time that those who were installing the asbestos in the actual homes were getting lung conditions that eventually turned into lung cancer. So now we have patients and people who come to me who had exposure maybe 20, 30 years ago, even 40 years ago, but it's now that they're getting the symptoms. You do an x-ray and they have full-blown cancer. So I say all of this to say that there is many different factors for why you have cancer. It's not necessarily cigarette use, but our goal is to expose and bring awareness to the different just conditions or these causes so that you can prevent yourself from getting it. So I'm glad that she wrote that to give me an avenue to talk about that. And the next person who I thought was a very good comment, commented in the comment section. Her name is Valerie Golston, and she said, interview with her was amazing and inspiring. I had breast cancer twice and also changed my diet. She liked her discussion about her spirituality and how it helped her cope with her husband's illness. Back to breast cancer, we need to be vigilant about helping Black women to fight this disease through early detection, obtaining higher quality jobs with excellent health benefits, etc., and ongoing organizations such as Share. So thank you so much, Valerie, for that wonderful comment. And I agree. This is the whole purpose of making October uh, Q&A with Dr. Mercy focus really on breast cancer because the awareness is key. Now, if you guys didn't see the last week, I did talk about prevention, but I can just give a little snippet here. Now, how do we prevent it? We prevent it by getting mammograms, right? And a mammogram is pretty much an image that just kind of that you go and get where they look at your breast and they look for any spots, any lesions, any masses. Now, the American Cancer Society recommends that people before 45, so from 40 to 45, consider doing mammograms. But definitely those after 45 should be doing their mammograms annually. So they said from 40 to 45, consider starting to do annual mammograms, but definitely from 45 and above. I also want to add something to that as well. If you have a family history of breast cancer, okay, and let's say you know of an aunt that got diagnosed at age 30, or your mom got diagnosed with breast cancer at age 30. Shoot, in your 20s, you should already go to your doctor and get on a preventative program where they will check your breast early. Because as I said last week, breast cancer in Black women specifically is more deadly than other groups. And the reason why is because we tend to have the triple negative breast cancer, and that's the most lethal, that's the most aggressive form of breast cancer. So early detection is key. Early detection is key, especially if you hear about breast cancer in your family history. Go to see your doctor and get detected early. Okay, so that's a spill that I'm going to be saying every week just to ensure that we all are aware of our breast cancer risk. But she also talked about another thing, and that is which was good. She was talking about how obtaining higher quality jobs with excellent health benefits. We all know that that when we have jobs with insurance, that can help with our health. Okay, as a physician, I want to stress that health insurance is key. I witness a lot in the hospital those without health insurance. Okay, unfortunately, treatment options can be rather limited. You could say, well, there should be health equity amongst everybody, but the realities is this: the realities is that you know treatments can be rather expensive, and there's only so much that the hospital themselves can cover. So if you don't have health insurance and something was to happen to you, yes, everybody should get the basic health care, and everybody majority of the time do. But for certain treatments, especially the expensive ones, they may not be available to everyone. So this is a good plug to maintain your health insurance. It's key because I have been in positions where I've taken care of patients, and ideally they should get a certain treatment, but the specialist cannot do that treatment because they don't have any insurance. And so, it's very devastating to have to go to them and say, hey, look, unfortunately, this is not an option for you. you want everybody to get the best health care. So if you can afford health insurance, go ahead and just get that done. Okay. So I'm glad she also talked about that. And then one last thing she did talk about, which I want to show, is the share organization. So I briefly looked through that organization, and it looks like a wonderful organization for those who have cancer and are women in general. So I'm going to add it to the stream. So this is the share website, and let me make sure I let me see where I am. I believe it's over here. Okay, this is the share website. You just go to sharecancersupport.org, and I really like just navigating just real briefly through their website. I was able to just see their mission and who they are. And I want to encourage those who know of anybody who has cancer and are women to come to this website. So I'm just going to read it right here just in case you don't see it. Share's mission. Share is a national nonprofit that supports, educates, and empowers anyone who has been diagnosed with women cancers and provides outreach to the general public about signs and symptoms. We're a compassionate community of knowledgeable survivors, women living with cancer, and healthcare professionals. Share is dedicated to serving women of all races and cultures, backgrounds, and identities, because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. So it's a 501c3 organization. And like I said, from what I gathered just by looking real briefly on their organization website, I mean, I'm just like at all with all the different resources that they have available. Um, if you look at their education program and support groups, they have just different programs from, like they said, from breast cancer, ovarian cancer, education programs, uterine cancer, cervical cancer education programs, metastatic cancer, even for the caregivers. So those who have to take care of those who have cancer, they do have some programs with them. So it's a very support groups, and not only support groups, but also educational programs that anybody, like I said, who has cancer or family members who know of someone who has cancer, or just friends, just I think this would be a very good organization to just share to anybody you know who may need it. Okay. So that is it. Letitia, I love what you say. Being proactive and developing a baseline for your health is key. I love that. I love that. I love that. Because that's the whole point of everything. Prevention is better than cure. Y'all have heard that before. Prevention is definitely better than cure. So if you can know your baseline, that is key for you. I understand that everybody gets scared. Like, I don't want to go to the doctor because I don't want to be told that I have high blood pressure or have diabetes or have this. But it's better to know now while it's not affecting you that much than to have the severe stage of the condition. I have been in the hospital. I've seen people lose their eyes because of diabetes, lose their toes because of diabetes. I see people have strokes, have hypertension. I'm just giving strokes and heart attacks because of hypertension. So being proactive and just knowing your baseline, know your baseline numbers. And that is just key. Know your baseline when it comes to your health is key. So thank you, Letitia, for bringing that up. That was a very good point. So so that was our discussion. That is just some of the comments actually that I saw when I perused the comment section on last week. And if you guys have any questions about breast cancer, feel free to write them in the comment section. And if you haven't seen last week's episode, feel free to see that after this session. Chester, good evening from Texas. I wonder where you are at in Texas, because I'm in Texas too. Good evening. So the next thing that I wanted to talk about real briefly is COVID, okay? Because we always have our little COVID updates. I'm always here talking about COVID updates. And that also leads me to just go to the CDC website, which I'm about to show you guys right now. Bear with me. to just figure out, okay, so what is up with COVID? I mean, should we be wearing masks? Should we be not? I mean, what are we doing? So I just wanted to kind of give you guys an update when it comes to COVID, you know, exactly what we should be doing. So bear with me as I go to the CDC website and we can discuss. Just a second. Okay, got that. We are sharing. So as far as the CDC is concerned, the CDC says the COVID data tracker that they have looks like, as of currently, as of today, the daily cases, as you guys can see in the graphs, are all declining. So there are still cases of COVID, but as you see, it's coming down from September to October. So the new daily cases are about 37,808. The deaths associated with COVID on a daily average has been up to about 332. The hospitalizations have actually gone down. It's gone down to 3,248. But also what's kind of a little bit low is the number of vaccinations, people who are getting their first booster dose. It's about 35.5%. So COVID is definitely coming down. Um, but what we also want to make sure we are aware of is, even though it's coming down, we are entering the flu season. So I have heard of cases of people who have been diagnosed with not only COVID but also with the flu. So this is my plug to get y'all to really consider getting your flu vaccine for this season. And also, there is a new booster that is out. As you guys are aware, with all the type of boosters, the boosters really only last for a few months before they start declining in efficacy. So, before their effects start to decline. So, if it's been within 6 months to a year since your last booster, you really probably need to get another booster. And the latest booster, they recommend that those who are age 5 and above should really get it. So I plan on getting my booster. I waited a little bit because I just got the flu shot, but and I just didn't want any potential interactions if there was any. But I do, especially now that we're going into the winter months, I do recommend the booster shot for the COVID. But it's very reassuring that the cases are coming down, hospitalizations coming down, deaths are coming down. We're also seeing in the hospital that we're not getting as many cases as we had last year around this time. So this is really, 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 really reassuring. That personally, me, I awesome. Personally, me, I actually got excuse me, what was I going to say? I just completely forgot. Oh gosh, what was I going to say? Okay, so personally, like I said, personally for me, I said I got the flu and I'm going to get the COVID booster. But personally for me, yes, personally for me, I'm still wearing my mask, and I'm still wearing my mask, and that also mask also helps with reducing your risk of COVID. And as Letitia says, if you're going to in-person conferences, family gatherings, you definitely want to get your booster. And consider wearing your mask. I know a lot of people are not wearing their mask, but I'm still wearing my mask, and that's how it is. And so, I think that's it for today. It was a really brief session. I just wanted to get on and just kind of discuss just a little bit about last week's part 1 of breast cancer with someone who had it. Next week, we're going to have part 2 with Tony Fowler and David Ajibadi, as he was the interviewer. And then after that, we can again have another post discussion. So until then, I definitely want to wish you guys a great weekend. And until next time, bye.